Welcome everybody to our seminar. Welcome to Looking Beyond Paint, Solutions to a Global Lead Poisoning Crisis, hosted by Pure Earth and NYU School of Global Public Health. As many of you know, this is International Lead Poisoning Prevention Week. It is hosted by WHO, and this week is designed to raise awareness of the scope of lead poisoning worldwide. While many events are going on this week, this particular seminar is focused on lead sources and exposure and addressing lead in paint to some extent. I'm pleased to introduce our stellar panel of speakers and moderate this seminar. I'll introduce each of these later on, but you could see here. Feel free to take a screenshot when you need to. That's very useful in the future. This is being recorded. A few housekeeping notes. We will record this and send you the link so that you can view it again. Please keep your microphones on mute to minimize noise, of course. There's a Q&A box. Please submit your questions in that box and we'll do our best to address it. We have about 15 minutes of Q&A at the end. And again, please send your questions this way. So let me begin. Many of you know me or have seen me on NYU campus. My name is Jack Caravanos, and thanks for attending today. And thank you, NYU School of Global Public Health, for hosting this, and a shout out to Chris Alexander. Thank you, Chris. About 15 years ago, I was invited to help countries address toxic waste sites that severely affect public health. What I saw honestly changed my life forever. Disparity in environmental risk between high income and low income countries is shocking, but fortunately it's come to the attention of the global public health community and improvements are occurring. The most serious environmental health threat is repeatedly announced as lead, and this is absolutely true. And the sources of lead poisoning vary between countries. In the US, lead-based paint devastated communities. But fortunately, environmental and public health regulations over the years have essentially put an end to serious lead-based paint poisoning. However, globally, lead-based paint isn't quite the main source. If you want to make an impact globally on hundreds of millions of children, follow the data to other sources such as used lead-acid batteries, spices, pottery, and a host of industrial sources. Global blood lead levels will never reach zero unless we address these other sources. Pure Earth has worked on lead source apportionment and exposure for many years, and I'm honored to be working with them. I travel with them, I do my assessments, and we're on the cusp of some very big scale up of solutions. Now, to give you a bit of a background, our first presenter was to be Richard Fuller. However, Richard is in France in a meeting with the minister and on environmental health matters, and this meeting is going on as we speak. He will be here at the end to do his concluding remarks. So excuse this change in schedule. So let me introduce the scale of global lead poisoning. Next slide. And many reports, including ones from IHME and WHO and the Toxic Truth Report from Pure Earth, have reported these numbers. 800 million children have elevated blood lead levels, and these are levels which cause harm. 1/3, essentially this ends up being 1/3 of children globally. And you could look at some of these reports, both by UNICEF and Pure Earth. Next slide. Of course, the big concern with lead is the sort of permanent, irreversible brain damage at a host of levels. So initially, we thought it was levels of 50 and 60, but as epidemiology and health studies progress, we see that even single-digit exposures where children have blood leads of 5 and 4 and 7 are causing damage. And this is essentially a loss of IQ points, which of course also is related to disability, learning disorders, and cognitive damage. There are more and more studies going on, the long-term damage from lead, including cardiovascular impacts, kidney, low birth weight. So this is an extremely toxic metal that does not belong in the blood, and our goal is really zero blood lead. And I think we'll see that. When you look at the damage of IQ, it's hard to appreciate it. So this very reproduced graph on the right sort of says it all, that the top is a normal sort of distribution of a mean of 100, an IQ point of 100, which is the sort of defined mean of a population. You have intellectually disabled individuals and gifted individuals. But as that curve shifts, you'll notice that we're losing many gifted children's capacity, and we're increasing the disability. And this is a long-term damage. This is not really reversible. And when you look at some of this data, it ends up being a loss of 3 to 5 IQ points. And of course, that is dose dependent. Next slide. Of course, in addition to IQ, this all translates to economic potentials. So you see here some studies that each IQ point is a decrement of 4% of GDP in Africa, 2% in Asia. So there are many studies and researchers studying the economic impact of lead poisoning. And I encourage you to sort of follow some of this data. But you're talking about 900,000 premature deaths. Now, when you look at our topic today, why look beyond paint? As I said earlier, lead paint was the dominant exposure pathway in the U.S., given the type of housing and the use of paint. Globally, this is not quite the case. And here's a study that looks at 492 published studies on exposure. And as you glance on this and look at what is really causing the lead poisoning, what really stands out, of course, is battery manufacturing and recycling, very high numbers of exposure, but even something like ceramics and diet and e-waste are very high. But in low and middle income countries, and this is the analysis in those 34 LMICs, you'll see very little attribution to lead-based paint. And that's because lead-based paint is expensive, it's really hard to come by, and truly not necessary in some of these climates. It's used in the US as a very strong paint in a wet sort of construction of homes, wooden homes. Anyway, what we're trying to do here is make sure we're balancing and attacking the dominant source of lead poisoning globally, and that's in low and middle income countries. Next slide. And when you look at the data and when you talk to me and listen to my presentations and do your literature search on this, you'll see that in low and middle income countries, lead acid batteries are the #1 source of exposure. Lead is a commodity, it has value, it produces sustenance for families, and is very easily recycled. So whether it's a family breaking a few batteries, or a small industry, it is extremely easy to extract this lead, sell it, and use it. And you see here, 85% of all lead is recycled. 85% of all batteries are recycled, and it's a very actually good commodity. But we've studied and done investigations of spices, especially turmeric, but also in paprika and also saffron. And of course, in Mexico and various climates, we have cookware. It's still a very common glaze that reduces the melting point of silica, so you have a nice shiny glaze. And this is even in New York City. I can travel into certain communities and buy lead glazed pottery, even though it's legally not allowable. So we're seeing all these major sources of lead pollution. Next slide. Now, what we want to do today is go over each of these in a little bit more detail, and I want to introduce you Pramila Sharma. Pramila is the country of, I don't know why I'm hesitating. I've worked with Pramila. I've been to India many times, and she's a close friend. But let me just read her bio. Pramila Sharma is the country director for Pure Earth in India, in New Delhi. She holds a degree in environmental sciences and has been associated with us from 2005, advancing its mission, providing research and facilities. She works with many of the staff and has a number of projects going on, and we'll start to talk about this. So I will let you go ahead. Pramila, due to some time zone problems, has recorded her presentation and will play it right now. Okay.
Thank you, Jack. Being an Indian, I have become a bit anxious to go through the findings of the recent Toxic Truth Report by Pure Earth and UNICEF that says, of all the countries in the world, India is the most adversely affected country by human and children's exposure to lead. The study referred the data provided by the Indian institutions to IHME that of the 900,000 annual premature deaths, over 26% are in India alone. And mind you, this is more deaths in India than are caused by HIV/AIDS. Equally horrifying is the finding that out of the 800 million children around the world, 275 million live in India. And of them, as many as 64 million have BLLs of over 10 microgram per deciliter. This extent of premature mortality from exposures to lead and the number of children impacted by lead is pretty enormous to make India the country with the most lead-poisoned populations. And not only the human health implication of lead exposures, but also huge economic impact has been estimated. The diminished IQ in lead-poisoned children leads to an increased cost of healthcare and reduced lifetime earnings, which in turn results in a loss of about 235 billions, 5% of India's GDP in economic productivity every year. Leaded petrol was once the dominant source of lead exposure in India until early 2000, when it got phased out. However, the problem of lead pollution and poisoning continue to be there until now. Existing investigations and studies, including the findings of our own projects, the Toxic Sites Identification Program and lead source apportionment studies recently in Bihar, suggest that the main exposures to lead in India is arising from the recycling of used lead acid batteries by informal or backyard operators who use crude technologies and equipments with no pollution controls and workers' protection in place. An estimated 50% of lead recycling is either in the informal setups or in the substandard facilities. Even among the formal registered facilities, environmental performance is below the Indian standards. Spices, adulterated turmeric, for example, is emerging as an additional contributing source where lead chromate may be added to enhance the bright yellow color and to add weight. Apart from that, aluminium cookware made from the recycled scrap metals or the lead-glazed ceramic pots and pans have lead in them, but this needs further investigations and research before concluding anything. The paints on the doors, walls, plastic toys, and other sources such as cosmetics tested in our study were found to be safe. However, after having painted this gloomy picture, let me share some of our efforts that we have made and are still making towards solving this problem. So this work in Bihar at Karmarichak, we found one informal recycler making battery plates from his home in a residential area at the outskirts of Patna, where a private primary school was located very next to it, with 250 or so kids below 12 years of age. The site was assessed to confirm contaminations of the soils, including fields, open play areas, alleys. The kids were tested for lead in their bloods too, and they were found to have very high levels, 5 to 6 times higher on an average than the prescribed values by WHO. We reached out to the recycler, local government body, community members, informed them of our findings and had them on board before taking up remediation actions and cleaning up the school. The public awareness drive that was built in our intervention moved the school principal and concerned parents so much that they took it upon themselves to make a formal complaint against the recycler to shut his operations to the State Pollution Control Board. and immediate action was taken, and the polluter was banned from operating there when we left. We feel happy to report that an aware community here is now mobilized enough to ensure protection of their environments and lives from this invisible, under-recognized health hazard. Let me also share this another ongoing intervention at another high-risk site identified by us in 2012 near Vellore city in Tamil Nadu state. We, together with the State Pollution Control Board and the industry association representatives, inspected a formal recycling unit and identified it as a major source of contaminating this small town where I am right now, inspecting the field work and conducting a source study. The unsafe practices for decades has contaminated 50 homes and a government-run child care center called Anganwadi in the neighborhood with soil net levels as high as 10 to 20 times than the standards. In 2018, the unit was served a closure notice by the Pollution Control Board when found continuing with dirty practices and illegal dumping of lead-bearing waste from his plant along the riverbed. When we revisited the site for initiating a risk reduction project and cleaning up of the homes and schools, the smelter owner approached us and decided to become a part of the solution. He is extending his support by having dismantled the smelting setup and ensuring the safe disposal of this waste lying in his storage area. And currently the major tasks underway are the civil work by a local engineering firm here to construct a drainage diversion to the school from the smelter in the slope, health assessments of the kids, cleaning up of the houses and the schools, community education drive, and source study to learn other potential lead sources at home to inform additional intervention strategy. And for a wider and effective impact at national level, we have established a partnership with National Institute for Transforming India, Niti Aayog, which is a national think tank headed by Prime Minister that is mandated to provide knowledge resources and strategic policy vision for government on all issues. At our request, the Niti Aayog has recently approached the National R&D Organization, the Council of Scientific and Industrial Research, to revalidate the findings of the Toxics Truth Report for India that I shared in the beginning. A team of Indian experts from the various medical, scientific, and research organizations is being constituted and publish its finding in the Journal of Environmental Science and Engineering, published from it's another institute of national repute. Reducing lead exposures across India require steps that focus on identifying lead poison populations, identifying significant sources of exposures to them, and then addressing priority sources through targeted intervention as the need of the hour. To achieve this, we have planned to form a national lead advisory group in the near future that would consist of experts from relevant government agencies, industries, local NGOs, and academic institutions to implement the well-researched and specific targeted strategic solutions. The primary interventions would include health monitoring across diverse geographies in India to understand severity and variations in exposures, followed by conducting a series of source analysis in different regions in India, including detailed testing of all possible sources of lead in highly exposed households, such as food, cookware, soil, dust, toys, plastics, etc. This analysis will help determine the most significant sources of lead in that city or state. The blood testing and source analysis will definitely guide intervention designing that may require regulations and enforcement, changes in industry practices, and changes in public education, consumer behavior as a strategy. Developing health systems for health monitoring and treatment infrastructure for the poison populations, and raising awareness of risk from certain products, All these activities will definitely empower public to take personal protection measures. Thank you so much.
Okay. I want to say that Pramila is actually in Vellore right now managing the cleanup, and that's one reason she couldn't be with us live. Okay, let's proceed to speak with Drew. Drew will announce that this is the 1-year anniversary of PECP, Protecting Every Child's Potential, a program here, which will scale up the work in these countries. Drew McCarter is a lawyer and environmental health professional with 12 years experience designing and managing environmental programs, international programs. Drew currently serves as Pure Earth's Vice President of Strategic and Strategy and Partnerships and oversees the organization's global lead program. Drew, thanks for attending, and it's all yours.
Thanks so much, Jack, and it's a pleasure to be here with all of you. So I'd like to talk about how Pure Earth is aiming to address this challenge, and specifically 3 kind of subtopics there. The first is how this type of lead work has evolved over the last 22 years that Pure Earth has been working on it. And then what major gaps still exist in our knowledge and ability to address it. And then some new types of programs and opportunities to engage that have emerged in the last couple of years. So jumping into the first topic here, when we look back at lead programs over the recent decades, my view, having worked on this for a while, is that lead work has been fairly sporadic. It has not been terribly well coordinated, and programs and organizations have not necessarily been building on each other's work and learning from each other as much as we could do. Lead has not been a priority among decision makers in low and middle income countries or among development agencies necessarily. And our prioritization in terms of using data to allocate precious resources could have also been better. And unfortunately, all of these things are changing. So today we see types of data that just simply weren't available in recent decades that have just emerged. We also see new actors coming into this space. UNICEF is a new partner of Pure Earth and of Clarios Foundation and is really engaged in this issue. And we also see an increasing recognition of non-paint sources. As Jack mentioned, paint has been a focal area of a lot of international work, but we just haven't observed evidence to suggest that all of the global resources should be focused on paint. There are other sources that deserve our attention. So fortunately, all of these things are changing for the better. Now, if we look at what gaps still remain, there are a couple. First, decision makers, both in national governments and in development agencies, are still not sufficiently aware of the societal costs of lead exposure and of the economic and societal benefits of tackling this issue. We also still lack a lot of data. While we have, for the first time, estimates of the average blood lead levels of children in each country, we actually have 2 sets of estimates from the Institute for Health Metrics and Evaluations and a second set from a paper published in The Lancet by Brett Erickson and colleagues. These are still estimates. And what we really need, if we just jump back, Sarah, to the last one, what we really need is localized data. We need blood lead level testing in the countries where we're implementing these types of programs. And then finally, while we have a good general sense of the leading sources globally that contribute to exposures, when we're working in a community or a province or a country, each of those communities is going to have its own basket of sources of exposure. And we need to have a key sense of what those local sources are. So that means source analysis at the local level. Now, if we move to the next slide, we'll talk about how Pure Earth organizes its interventions. So on the left, of course, before and throughout our interventions, education and awareness raising are key. This basically sets the table for future work. And then we do it throughout our interventions. And our interventions rely on 3 basic building blocks. The first is developing a keen understanding of actual exposure levels in the communities that we're working in. And that means testing children's blood. We need to know how severe the problem is, and also which specific children, which specific households, which specific geographies and communities are more or less exposed to lead. So that's really a foundational building block, is understanding the status quo. And then our programs move on to what we call source analysis. And that means going into the households of highly poisoned children and testing all of the products and media in their homes that could be contributing to this. So that means testing their toys and their water and their food and their spices, the paint on their walls, the soil outside their home, maybe also the soil at the local playground or at their school. Because if you don't do this type of local source analysis, an organization could spend a lot of time and money chasing the wrong source, essentially. Addressing a source that we think is driving exposures, and then we find out later that it was actually something completely different. So both the blood lead level testing and the source analysis are really important for designing the right solution. And once we have those two things in hand, then it's designing source-specific mitigation programs. And if we go to the next one, I'll just spend a minute showing you kind of the difference in strategies between a couple of different sources. So if, for example, we're trying to address the substandard recycling of lead acid batteries, the program probably starts with an assessment of the national situation. How do batteries flow through the economy of that country? How do they move from consumer to collector, to trader, to recycler? And what are the economic incentives that have created that system? Then it's about developing a national strategy, developing policies that change those economic incentives, helping regulatory and enforcement agencies, providing technical assistance to those agencies, providing technical assistance to the recyclers so that they can improve their own standards, and then what Pure Earth has been known for many years, cleaning up contaminated sites. But for example, if the source is something different like spices or cookware, then it's much more about supply chain tracking and trying to find those producers that are introducing lead into a product completely unnecessarily. So the point here is that each source has a specific set of interventions that follow a different progression from other types of sources. Now, if we go to the next slide, I want to introduce a really exciting new program that was launched a little over a year ago. That is a platform for scaling up these types of programs and for introducing new actors into this space. And that is called Protecting Every Child's Potential. And this was an initiative that was launched by Pure Earth, Clarios Foundation, and UNICEF. And it is meant to be a foundation that can make it easy for new actors to come in and work on lead and learn from each other and coordinate with each other. So we started this a little over a year ago with a generous seed grant of $15 million, those 3 founding agencies and 5 country programs in Mexico, Ghana, Georgia, Bangladesh, and Indonesia. And I'm really pleased to announce that in just the short period of time since we launched this, we've already increased the amount of funding under this program by $8 million. We've grown from 3 to 8 member organizations, and we've introduced 2 new country programs in India and the Philippines. And for us, the future looks like more of that, more funding, more members, more projects, and of course, the ultimate goal of less exposure. So in conclusion here, we still have some significant gaps that need filling. In particular, it's about institutionalizing blood lead level testing. This happens in high-income countries frequently. It happens very rarely in low-income and middle-income countries, but they deserve it and they need it. So we need to find ways to institutionalize that type of testing. Then we need to identify the contributing sources in that specific geography. And we need to use those 2 pieces of data then to prioritize global efforts to tackle the most urgent sources, the most exposed communities. And then finally, as I started with, there's been a lack of collaboration, information sharing, and partnership. And we now have a beautiful platform for just that in Protecting Every Child's Potential. So I encourage people to visit the Protecting Every Child's Potential website, which is just protectingeverychildspotential.org, or get in touch with one of the 3 founding agencies, and we can help bring you along. Back over to you, Jack.
Thanks so much, Drew. I just want to highlight some of Drew's points, and the most important, especially since there are so many public health students listening today, is surveillance. And there is not a wide-scale global blood lead testing program. And one of our goals is to really get more and more countries to at least do an initial screening. So without this data, it's hard to really understand where the problems are localized and what the distinct solutions are. Our next speaker was to be Daniel and Anna. Daniel Estrada is a staff person here at Pure Earth, but unfortunately is also stuck in a meeting with a senior official that he asked us if he could delay his presentation. So I'm going to switch gears and actually logically flowing from what Drew just said, move on to Dan Cass. Since 2006, Dan Cass has been Senior Vice President for Environmental Health at Vital Strategies, a global public health organization that supports governments and civil society's efforts to strengthen public health systems. He was previously Deputy Commissioner for Environmental Health at the New York City Health Department. And for a couple of hours, he was the commissioner. I remember that, Dan. It was a good party. At the U.S. Premier Local Public Health Agency, I think you know that New York City Department of Health Lead Poisoning Prevention Program is a model program doing wonderful work, where he led a team of more than 1,000 sanitarians, epidemiologists, policy analysts, and clinicians in addressing some of the leading environmental health risks in the city. In that capacity, he oversaw the entire lead poisoning prevention program. So Dan, thank you. He's going to be talking about engaging health systems, which again follows Drew's comments very well. Okay, Dan, it's all yours.
Great, thanks, Jack. And might I say, I've known Jack for almost my entire public health career, and it's been a pleasure collaborating with him these many decades. So next slide, please. So I want to continue from the earlier discussions by elaborating on this link between data and policy and why it's really so important for health systems to be all in on lead poisoning prevention. You know, you've heard that there are real critical imperatives for policy improvement. Broadly speaking, these relate to source reduction, elimination and substitution of lead in products and in processes, modifying industrial practices to reduce emissions and workers' exposures, and regulating and enforcing best practices where currently there are gaps, especially in informal and artisanal work. Next slide. Now, policies, of course, are best formulated using evidence, and for evidence, we need good data. The work you've heard about all have some things in common. They collected important information to characterize exposures, but often data is collected only in small areas. We need much more information to influence population level risk and to reduce it. So to whom does exposure occur? Are exposure risks inequitable, meaning do they occur more to some groups? You know, in many countries, those at greatest risk of lead exposure and to their consequences are the same people who face other social vulnerabilities, including discrimination. And finally, among the myriad sources of lead, which matter the most? Next. So I'm speaking here about really trying to characterize population level risks, exposures, and opportunities. The engagement of the public health system, which you can think about broadly as both the preventive, diagnostic, and treatment components of health systems, that's really essential. Public health and epidemiologic analysis helps to rationalize expenditures and direct resources where they're needed most and where the benefit can be greatest. So to do so, exposures can be evaluated and reported. You've heard a bit about that. But the public health system also needs to educate parents and caregivers. Public health can track trends in risks and exposures. And despite, recent setbacks during this COVID-19 pandemic, public health is generally considered a credible source of evidence for policymakers and by the general public. Next. So at Vital Strategies, in partnership with Well, at a Hill Foundation, Pure Earth, and GiveWell, we approach this question of public health systems engagement through 4 approaches: surveillance, risk assessment, practice guidance, and professional education. And I'm going to just talk very quickly about each of these components. Next. Representative surveillance means evaluating exposures to characterize them across a population. Using some of the same techniques that work at an individual level, if one selects children to evaluate in a way that they collectively represent the population of children, then you can learn a lot, and you can learn it quickly and comparatively inexpensively. In the United States and some other countries, blood lead testing in children is universal, meaning nearly everyone gets tested by a certain age. And that's not possible in most countries. There's limited laboratory capacity to analyze whole blood for lead. And in many countries, passive surveillance occurs, meaning that when a child is very sick and a clinician suspects lead poisoning, then a test might be ordered to confirm it. But that approach and relying on it fails to identify many who are at risk. And remember, as this graphic at the right shows, the societal impact of lead exposure is generally greater from more people being exposed at lower levels than comparatively fewer being exposed at higher levels. Also remember that the map you've seen of average blood lead levels across the world, that's modeled data. It's not measured data. So we're conducting representative surveillance in several countries, and it uses statistical methods to select a representative population, test them for lead, educate their parents, and follow up for those with the highest exposures. But this approach enables a country to set up a system that can, by repeating the work at some interval, evaluate trends and evaluate the efficacy of interventions, some of which you've heard about and you will hear about from the other speakers. So this approach enables us to learn more about the exposures of the sources of higher exposures, also about the consequence of lower exposures to more people. Where we have high exposures discovered during the surveillance, I should say that we do follow up with a home visit to those children or to the pregnant women who are tested and do a home evaluation for sources of lead, just as Drew described as part and parcel of their routine site-specific or location-specific program. Next slide. The second approach to public health engagement is addressing risks, even when you can't test every child. For example, in Peru, we've been working with the Ministry of Health to develop risk assessment guidance for clinicians. We already know, and with more information learned from surveillance efforts, continue to learn which practices, devices, materials are important sources of exposure. Asking about the use or presence of those and other behaviors during routine clinical care can help evaluate which children are at risk. And with that, clinicians can provide important information to parents about how to reduce exposures, even in the absence of blood lead testing. Again, thinking about public health systems, collecting the responses to these simple questions can also serve as another surveillance system for local health departments. And if that data is rolled up to ministries of health, a national risk surveillance system. That's what's happening now in Peru. Our approach scores a child's risk based on vulnerability factors, like whether they live in an area known for contamination or without access to clean water, individual and family risks like occupation and food preparation practices, and clinical suspicion for anemia and developmental delays, which are much more routinely tested and testable. And based on that risk assessment, children can then be directed to scarce testing resources for lead and to appropriate outreach, education, and if necessary, treatment. Next slide. The third approach to public health engagement is to develop or improve national professional clinical care guidance. Clinical guidance is a set of best scientific and professional practice to inform how clinicians interact with and diagnose and treat illness. Guidance can be issued by professional associations, or scientific bodies, or governmental agencies. And lead, unfortunately, is often absent from such practice. Or the limited guidance that does exist is based on the United States CDC's guidance, which entirely depends on access to universal blood testing of children and pregnant women. So we're working to evaluate and improve those kind of guidance practice documents to educate clinicians, incorporate this risk assessment approach that I just described in a way that really reckons with the reality of resource limitations. Interestingly, the World Health Organization will be issuing its own clinical guidance for lead poisoning shortly. In Indonesia and in other countries, we're going to be working to tailor those to local context in collaboration with ministries of health. Next. And finally, public health engagement requires professional education. Even in the United States, medical students learn very little about the environmental determinants of health. In low and middle income countries, discussion of lead poisoning is often entirely absent from their training. And without training, clinicians don't know to inquire about lead exposure or evaluate symptoms associated with it. They may not know very much about the local circumstances of risk, whether there's soil contamination or water contamination, whether certain foods or cooking utensils leach lead. And to close this gap, we're working with student medical associations, professional societies, and ministries of health to provide core curricula and continuing education. Given the trust conferred on clinicians, it's also important that they advocate on behalf of children. Vital Strategies and other organizations around the world are working to help build advocacy skills among future and current clinicians so they can amplify their voices to affect change on behalf of populations and not just individual patients. Next. So in sum, we implore those around the globe to recognize the importance of health systems in addressing lead poisoning. Public health rarely has direct control over mining, industrial practices and water quality or urban planning, all these features and sectors that really do influence the presence of sources of lead. But public health can be a strong voice to really amplify efforts in those sectors to improve conditions. The tools of public health, epidemiology, translating science for lay people, clinical care improvement, all of these can be better brought to bear to improve the living conditions of the millions of children exposed to unacceptable levels of lead. So thanks very much. And Jack, back to you.
Thank you very much, Dan. Now we'll hear from Daniel Estrada and Ana Margarita Garza. Daniel Estrada is the country director for Pure Earth Mexico and is responsible for the management and implementation of all of the organization's projects in Mexico, including the Barro Aprobado project to remove lead from the traditional artisanal ceramics industry throughout the country. He'll be accompanied with Ana Margarita as treasurer of the Clarios Foundation, and she'll explain that link shortly. She leads Clarios's circular economy and sustainability efforts throughout Latin America. Since 2015, Garza has worked with Pure Earth and secondary lead recyclers in Mexico to bring awareness to the studies that discovered pottery is one of the main sources of lead poisoning in Mexico. And this is a large source of exposure, and we're fortunate that there are practical solutions to this, but it's hard to, of course, implement them throughout the entire country. So let me ask Daniel to take over, and of course, Ana Margarita will follow. Go ahead, Daniel.
Thank you very much, Jack, and a pleasure being here. So as Jack mentioned, I'm going to talk about the problem that is going on in Mexico regarding lead. As Drew mentioned, the approach is blood lead level testing, source analysis, and source-specific exposure mitigation. So in Mexico, we have done for the first time a national study on blood lead levels. The results, you are able to see them on this graph, and you can see on the right-hand side, we have the highest blood lead levels to one state, Puebla, where 47% of the children have high blood lead levels. This is really astonishing. This is something that shouldn't be happening. And if we take that average, it's 17% of the children in Mexico are intoxicated by lead. And also considering where is this lead coming from, where we have two colors. The blue one is not necessarily related to lead glaze, but there might be sources. It might be the lead glaze from the pottery that is hidden somewhere. And then on the red bar, the red part of the bar is certainly that's regarding that's due to lead in pottery. So the next graph is the same information, But in here, we are seeing it in a map. We are seeing where the highest blood lead levels are, and we can see a pattern. We can see that in the center of the country, we have the highest blood lead levels. So that gives us a reference that why is that happening? And we can see why this is happening on the next slide, please. So here we have the pottery production. So we can see that there's a relation, and it might be a correlation between pottery production and high blood lead levels. So let me tell you a little bit about how lead gets into pottery. First of all, we have the first piece. We have this, for example, this mug. It has no glaze. So they take the clay out of the earth. They take the clay. They made this beautiful piece. They put it inside of a kiln. They burn it, and then we have something that can be useful. The problem with this one is that if you pour water, then the water is going to leach out. So there's this technique of putting glaze, lead oxide glaze. So they put this glaze, this shining glaze. You can see that it is not all covered. This is the clay, and this is the glaze. So the glaze is lead oxide. So the lead oxide goes into the food or into the drinks. If it is a hot or an acidic drink or acidic food, then the lead is going to leach into the food, and it's going to get into the system. So we can see that pottery is found in Mexico, all around the country. Is produced mainly in these 20 states that we are seeing, the ones with the highest red part, but it's consumed in the whole country and sometimes in the US. As Jack mentioned, we can find pottery in New York, lead-glazed pottery. So what are the authorities doing? Can we move to the next slide? Because sometimes the first solution would be, so let's make some rules, let's make some legal framework. But we don't need to do that in Mexico. We have it. We have a perfect legal framework. It is forbidden to sell lead oxide, or it is intended not to be sold lead oxide to the potters. Then we have maximum lead limits for the pottery. And we have a regulation that establishes what are the maximum limits of lead in human beings. But the problem is that this is law that it is not applied. So we would need to do law enforcement. We don't need to make laws, but we need to apply them. Next slide, please. So what we are doing as an NGO, we have a program that is called Barro Aprobado, which mainly what it is looking for. It's to have restaurants that are lead-free, that are Barro Aprobado, stores that sell lead-free pottery, and potters that are lead-free. Here we had two options. We could either talk bad about the pottery and remove a tradition that has been going on for thousands of years, or we could promote the lead-free pottery. So the program consists on training the potters to go lead-free, doing remediations, and the remediations are really something that changes lives. I remember asking one potter, do you feel any difference after we did the remediation and your blood lead levels went down? And he said, in me, I didn't notice any difference, but in my children, they were like all, they didn't move, and now I cannot stop them. So we changed their lives. That's something really important, and that's what we are looking for. The other part of the program, it's not only with potters, but it is with retailers. So we have a program to sell pottery all around the world. But this program had been going on for some years, and it was next year, as Drew mentioned, that we are 1 year, we are celebrating 1 year of protecting every child potential, in Spanish, protegiendo el potencial de cada niño. And that was a game changer. And we are very thankful for Claros Foundation for joining in Mexico to take this program to the next level. And I will ask Ana Margarita to continue talking about what we have been able to achieve in Mexico thanks to protecting every child potential. Thank you, Ana Margarita.
Thank you, Daniel. So the first time we learned about the problem worldwide, but also in Mexico, I was astonished. And Claros Foundation is part, it comes from Clarios, a company, a very large battery producer and recycler. And when we we're aware of the magnitude of this problem, we basically have three options: deny, say that we do things the right way, or be part of the solution. And we chose the last one. Being part of the solution means accepting the problem, but also being active, doing something about it. And part of our interest in this is, of course, our main and raw material for batteries is lead, but we want lead in a plastic box. It contained, properly taken care of, and not in food, in cookware, or in illegal recycling. So we started and we partnered with Pure Earth and UNICEF through Caravanos Foundation. And basically what we're trying to do here is mobilize collective actions to address the sources of exposure, to assist governments to ensure that recycling and use of lead is done properly, but also, and more importantly, mobilize the private sector. Next slide, please. And this, what we have done is, this roadmap has been to launch this initiative, PECP, and then getting into the implementation mode, in which we have started to bring awareness in a larger scale, which is important, but also educating the communities to change that in a way that it's not detrimental to their economy and their living. And of course, advocacy, as Drew and Daniel mentioned, we have the rules, but we need to enforce them. But we need better standards, and we need to do this by mobilizing as well and bringing and building a pipeline of countries and projects, not only in Mexico. And in different countries, there are different issues that need to be addressed. But if that is done with the help of the governments, of the help of the private sector, and of course, of a lot of organizations in part of this, and you can see some of the work that has been done. Can you go to the next one, please? And here, at least in Mexico, what we have done is we have tackled, as you can see to the left, those are part of the projects and things that have been done in improving the ovens, the traditional ovens or kilns, training women and making them what we call the circles of women, because they are really interested in taking care of the health of their children. Creating lead-free neighborhoods in which restaurants, hotels, small businesses are part of this solution, not only the problem, but the solution. In the promotion of the lead-free pottery through new channels. And of course, now we are about to do other projects like Food Without, the Lead-Free Food Alliance, and which we are trying to mobilize other parts of the sector and publications that help with all this to make the message go the right places, but mobilize the whole country to be part of this solution. And so I urge people to get interested, to get involved, to be a part of this issue, not only in Mexico, but in the different countries around the world, to make this happen, to protect every child's potential and make them be free of lead exposure in the very near future, because this is something that can be solved. Thank you very much.
Oh, thank you very much, Daniel and Anna. Well done. We actually have a couple of questions about artisanal pottery, and I think you may know that there was an episode here in New York about some poisoning associated with this. So this is a very important issue. Before I hand it over to Richard Full, I just want to say that we could have done hours and hours of presentations on Armenia and turmeric and lead mining in Zambia and Zamfara and battery breaking in Senegal. So there's so much out there, but we wanted to focus on these three areas because they are sort of prototypical of the problems. Many years ago, someone called me up with a quick environmental health question, and that was Richard Fuller. And then he called me up with another question. Then he said, can you join a committee? And one thing led to another. And I've traveled to over 45 countries working on some of these issues. So Richard, thank you for opening my eyes and allowing me this opportunity. Richard is an engineer best known for his work in global pollution remediation. In 1999, he founded Pure Earth, where he currently serves as CEO. There, he rallies attention to the underreported issue of pollution and its impacts on low-income communities worldwide. I've been working with him, and he travels a lot and is very active in the management of bringing the attention of pollution to the global world. Rich, welcome. I'm glad you were able to finish your meeting and get here and give us the call to action. So Rich, go ahead.
Thanks, Jack, and thank you everyone for a really interesting presentation. I'm sorry I wasn't here at the beginning. I've been meeting with the chef de cabinet of the Macron government, and there's a really strong response, not just from France. I'm in Paris right now, but similarly, other meetings in Brussels with the European Union and in Switzerland with similar agencies. And tomorrow I'm meeting with the head of the Ministry for the Environment, the minister for the UK. So there's some good stuff going on within the Europeans, and rightly so, because this issue with lead is really extraordinary. If you think that a third of all the children in the world are lead poisoned, it's a permanent damage that occurs. So that means that a third of the world suffers from the consequences. It means less intelligence, less capability of being able to become as productive as they should be, more likely to be involved in crimes of violence, more likely to have problems in aging as lead affects the brain in so many different ways, more likely to die early from cardiovascular disease. We're talking about a third of the whole world suffering from this, mostly in low and middle income countries. So this is an issue on the scale of any other global issue. You know, it's perhaps not as serious as climate change, but it's right up there in the order of magnitude. And yet we don't really know that much about it. It's not a public concern at the moment. So there's room now for so many different new initiatives in this area. Any NGOs who are listening should get involved with this. Corporations who are concerned, come in, get involved, join PECP, join this side of things. There's so much work to do, because the interesting thing in all this is it's not just that there is an issue of scale that's causing so much damage in the world. It's also quite solvable. And if you want to do something productive in the world, what could be more productive than this? So I think if we can all gather together, governments, nonprofits, corporate sector, all of us work together to fix this issue, we'll have done something really amazing. So I encourage you all to that. And now I pass it back for questions. Is that right, Jack, to you?
Actually, the first question, and thank you, keep the questions coming. We have a lot of them. We're doing great. It's 10 o'clock, so we have plenty of time for some questions. Again, keep them coming. If you want them addressed by a certain speaker, by all means, put that in your chat. Rich, the first question for you is essentially, what's the cost to countries to implement these interventions? Specifically, and who are the actors supporting the efforts if countries have competing interests? And maybe you could address this dilemma with competing interests in that. So again, talk to us about the cost of implementing these interventions. And if I may ask speakers, answer the question and stop, and let's move on to the next question. Go ahead, Rich, sorry.
You're welcome. I think you have to look at the cost of intervention against the cost of inaction. And the cost of inaction is the economic cost from loss of intelligence. This is the one thing. You know, for every IQ point that's lost, your lifetime earnings are reduced because you're not as entrepreneurial on average or as productive on average. So those numbers rack up into the trillions of dollars, into the thousands of billions of dollars. Now, the comparative cost of interventions range from some very small interventions like spices. It might only be tens of thousands or hundreds of thousands of dollars over a few years, to more complex interventions like those associated with battery recycling that might be in the tens of millions of dollars for a large country over a series of years. But it never ranks into the billions, and yet the benefit is in the billions. So the cost dynamics of this are extremely, extremely exciting. Is that enough to answer that question, Jack?
I think so, and that's a very important point, the cost of inaction. This is a very important concept, and thank you for focusing on that. Very good. The next question is about Peru. How does lead contamination in Peru compare to other countries in Latin America? And I want to say that one of my first trips was with Rich to a very polluted site in Peru. And I think I'm going to ask Dan, since I know you're doing some work in Peru, or Vital Strategies was doing some work in Peru. So how does it compare in Peru, Dan?
Well, I also want to turn to colleagues at Pure Earth who've actually done cleanup work in Peru. You know, my work is focused principally on engagement with the Ministry of Health, but Peru differs from Indonesia, say, for, you know, and Mexico in many ways, because much of the contamination that's known, at least, is the result of, you know, centuries of mining contamination from lead directly from mining for gold and other heavy metals that have contaminated largely rural communities. We also know that paint probably matters in Peru. Lead paint is only now being regulated. It was previously largely unregulated and unenforced. There's many things we don't really know yet. You know, Peru does some very good surveillance on imported products, but does not have a good surveillance system for foodstuffs or for other materials. So much is unknown, but mining is a really critical source. And I'll turn it over to Pure Earth for, you know, additional answers based on some of their cleanup work.
All right, well, let's move to, by the way, while Peru, as I think you all know, is a very big mining country, and there are a lot of lead mines, secondary smelters going on there. However, it also has, of course, as any urban site, has used lead acid battery recycling and, of course, pottery. So these problems are not unique to just one country. So, but let's talk about ULabs. There's a question here, what's being done about lead battery recycling? And with specific question about what's going on in Europe. Are there lessons to learn there? And Drew, I'll ask you to answer this, and maybe you could differentiate all the different types of informal activities that are out there. Go ahead, Drew.
I think Drew has had to pass out to another spot. I'm happy to take his spot. I think he took mine earlier in the event.
Okay.
ULab recycling, the solution in ULab recycling involves taking especially people who are at the very bottom of the rung in recycling, who are taking car batteries and smashing them open with an axe and then tipping out the acid onto the ground and then pulling out the innards, which are a lot of plates made of lead and a lot of paste that's lead oxides. And taking all that and putting it into a drum and literally melting it down to reclaim the lead that's there. When they do that, there's a huge plume of black smoke that's mostly lead that goes up into the atmosphere. And as much as 20 to 25% of the lead within the battery is actually lost to the environment and poisons kids and potentially poisons food crops too. So that's the very bottom of the chain. And those guys need to find other jobs because this is an incredibly dangerous, toxic thing to do with one's life. The next level up are recyclers that might have some equipment. They might have some some smelting equipment. So they might have a furnace, for example, a rotary furnace that uses gas-fired or oil-fired to heat up materials. And many of them don't run their pollution control equipment, or their pollution control equipment is just not very good. And they also release a huge amount of lead into the environment. Now, at the very positive end of the spectrum, large companies, and Clarios is a good example, they operate very large facilities that cost hundreds of millions of dollars to operate. And there they'll have negative air pressure inside their facilities. They'll have very clean scrubbing equipment with electrostatic precipitators and all kinds of other different technologies. And they'll monitor very carefully all of the releases that go onto the environment. And that's our end goal. That's what we need to have happen throughout all of the different countries that are there. We need to help governments to move this whole chain of recycling up into the clean formal sector. And doing that needs capital. So there's capital market requirements that are going to need to be done here, along with regulatory responses and economic incentives to be able to move the industry through. And it's a complicated, long-term process. It's going to take probably a decade in many countries and maybe even longer, but it has to happen.
Thank you, Rich. The next question, I think I'll direct to Daniel and Anna. I'll read it verbatim here. Have you heard of the recent New York City Department of Health and Mental Hygiene health alert warning of 15 New Yorkers that were lead poisoned due to traditional glazed pottery? How do you respond to claims of attacking culture by warning against the use of traditional ceramic ware for cooking and serving foods? And you see here some of the dilemma in that we're trying to protect the public, but we're also trying to be, of course, culturally sensitive and appropriate. Daniel, do you want to talk about that?
Yes, I think that's a very good question. And that's something that happened in Mexico some years ago. When we found out that the problem was still going on with the pottery, there was a message that was given from the government to the public, and it was like that pottery had lead. And what happened is that the consumption of lead-free pottery, of pottery went down in general. So I think we have to separate pottery from lead. And that's exactly what we are trying to do. To give the message that it is not needed to have lead glaze on the pottery. And of course, we cannot protect a culture that it's been toxic. We cannot say, okay, because it is culture, we need to continue using lead oxide. I think that this is an effort that has to be done from the Mexican side, from the Mexican government, and from the Mexican social society to be working with lead-free pottery. And the message is clear. We cannot continue a tradition that is toxic to the people, and we need to have alternative solutions. So actually what we would like to do is to see in the future, to see all of New York full of Mexican pottery, but that it is lead-free. So it's something that we are still have to work, but certainly we shouldn't protect something that is been toxic just because it is culture. What we need to do is to change that culture and to remove the toxins from it. I don't know, Ana Margarita, you?
I would only add the importance of creating awareness, but awareness aimed at the solution, which is pottery is safe if it does not contain lead. So consume lead-free pottery. Batteries are not the devil. They help us strive and go about almost anything in modern society. But it is okay if lead is inside a sealed plastic box as a battery and it is handled adequately. So I agree with Daniel, the importance of maintaining tradition, but a healthy tradition, and removing those sources, it is really important. And for that, we need awareness from all the different types of organizations that can help bring that message about.
Thank you, Anna. Thank you, Daniel. Very good. I'm going to ask Dan to address the next question, given his background in with the New York City Department of Health and the work he's doing globally, which is, how do you introduce lead diagnosis in the health system in developing countries. And I must say, I'm always shocked at how many primary care physicians are really not aware of the exposure, the damage, and of course, the diagnosis. So Dan, how do we get a hold on this?
Yeah, this is challenging. I mean, you know, one thing that's really clear and that confounds clinical diagnosis is that the vast majority of exposures to lead result in subclinical effects that are not detectable during normal, you know, interactions with patients. Lead is insidious. Its effects are seen over a long period of time. It bioaccumulates. And so it's very difficult to tell whether a child has been lead poisoned just from, you know, direct interaction, you know, with a patient or with a child, absent a blood lead test. And as I mentioned earlier, you know, blood lead testing is really a scarce resource in most of the world. It requires, for at least whole blood testing, it requires laboratory capacity. It requires a really good supply, or rather, a chain of custody between the collection and the analysis, and it requires follow-up, you know, sort of days or weeks later with patients, which is really a challenge in a lot of settings. So what can be done? Well, one of the things that I was trying to get at in my brief presentation was that clinicians can really do risk assessment. If you ask the right questions about the home environment, about the occupation of parents, about you know, some sort of mild sort of clues, behavioral clues of parents about their children, you can hint at risk. You know, we know that risk can be reduced through behavior change, whether that's, you know, different cleaning techniques in the home, sort of planting plants where there is bare soil, you know, removing suspect materials from the home. These kinds of practices make a huge difference in the potential for exposure. So I think the principal strategy, especially in lower resource settings, is to instruct clinicians on how to assess risks rather than direct exposure.
Okay, thank you. It is a challenge, I tell you. But it needs to be addressed. It's a piece of the solution. I think I'm going to take the next question, which is, what do you typically do when you conduct fieldwork in these countries? And having been here from the start, initially we would send a team and we would do our visual inspection of a site. On and on, we got more scientific, if I may say. We started bringing instruments which measure contamination. And over the years, we've been able to transfer technology and training so that field staff, usually local field staff at these countries, do the assessments according to a very rigorous protocol. Essentially, we're using a bit of an EPA model, but we target it to health. And many of you have heard me speak about pollution. Is it present? People, are they present? And of course, the last P is pathway. Is there a road from the pollutant to the person? And if all of those three line up, sort of a Venn diagram, then it's a serious effort. And of course, the more people, the higher level of the contaminant, and the faster the multiple pathways sort of triggers action. So initially, when Pure Earth started, it was sort of low-hanging fruit on the polluted places, but now we actually do it in a much more thorough and investigative fashion, and very often with the help of countries and environmental ministries in those countries. So there's that. The next question I want to pose, I'll throw it out to anybody, which is, how do we convince people in the US to take some of these issues seriously, since low and middle income countries are far away and the link may not be quite so obvious? So how do we convince these people? I'm going to throw it out to the panel, and who would like to address that?
Hi, guys. So, you know, this is an interesting conundrum. There's two levels of response to this. The first, I think, relies on looking at the corporate sector, where the US and the European Union are leaders. And what we ought to be remembering, too, is that every company in the world uses car batteries, either in the cars that they're using to deliver goods and services, or if they're telecom, they're at the base of every telecom tower. They're in the uninterruptible power supplies of every technology company, backing up their data centers. There are these lead acid batteries are everywhere, and so there is a leadership needed within the US as well as the EU, considering I'm in France right now, from the corporate sector for an issue now that's upcoming. That's one thing. The second thing that we think is critical is that there ought to be an issue in development agendas for overseas development assistance to deal with lead. There has been some response from donors, especially the US and the Global Environment Facility, to deal with lead in paint. And that's great and interesting, but now it needs to stretch to being all of these other issues that are much more substantive in terms of their exposure risk. So we want to see development assistance driven with leadership from the US, where it has stemmed from originally with lead in paint, now expand to looking at all of these other issues with pottery and turmeric and batteries and the like. So there is a really strong case here to do the right thing. Also because, chemicals don't stay in their place of origin. They move in the air, they move in the supply chain. They end up getting everyone eventually. So if we don't, deal with it, it will come back to bite us.
Thank you, Rich. And I just want to remind everybody that we do have a report on transboundary pollution and how these chemicals, as Rich just said, are not localized. They do spread in the entire global economy and food chain. We're at the end of our time. Thank you for your patience with us. I want you to check out Pure Earth's Global Lead Program at pureearth.org, pureearth.org for more information. I also want to remind you that this is WHO International Lead Poisoning Prevention Week, so there's a lot there. Just type in WHO lead poisoning and you'll see many seminars going on. And thank you for participating, and please stay in touch and onwards. Thank you very much. Good day now.